Roles and responsibilities of nurses in the implementing the Mental Health Care Act 2017. The Mental Health Care Act brought significant changes in mental health care treatment. This act lays down several procedures due to duties and complaints for mental health professionals. Admission discharge procedures, administration of ECT. ECT means electroconvulsive therapy, and other special procedures are modified. Psychiatric nurses are required to comply with these provisions strictly. Failure to do so is regarded as an offense under the law and will. The introduction of the roles and responsibilities of nurses in implementing the Mental Health Care Act. Actually, the Mental Health Care Act brought a significant changes in the treatment during to give the mental illness patients. Sometimes when the nursing profession is going to be give the any treatment to the mental health care patients, they didn't take the any consent from the mental illness patients. So during that time the patient will be getting the fear, and the profession has to roll off to take the consent from the patient. Because of that taking the consent from the patients, the willing of the patient is the one of the major role in that during the treatment. The mental health care, this is act enacted by the Mental Health Care Act. It is enacted in the 2017. So many treatment are we are seeing in the mental health care treatment in for mental patients and psychiatric patients. The electroconvulsive therapy and ECT means electroconvulsive therapy. Electroconvulsive therapy is not given by the any nurses. It is given by the professional psychiatric patients, professional psychiatric nurses only. The electroconvulsive therapy is not given by the randomly. It have a time to do the electroconvulsive therapy. Because of the time, during the time when we are giving that electroconvulsive therapy, the patient will be get the enough electrical impulse to the brain. When we are giving the electrical impulses to the brain will be getting the stimulator. So the man will be get the consciousness. The electroconvulsive therapy is mainly used in the when the patient is in the unconscious during that time. If and that it is only prescribed by the psychiatric professions only, and other special procedures. Psychiatric it is the introduction of the roles and responsibilities of the psychiatric nurses. The psychiatric nurses is another role is educator and organizer. The qualities of the psychiatric nurses. The qualities of the psychiatric nurses. Psychiatric nurses is are educator, organizer, and be aware. Now we will go with the educator. Educator means the nurse always should be learn from the new skill. Always learn the new skills. Educated during the student period. During the student period, the nurses educator are there. The nurses educator will be helpful to the student nurses to teach each and everything regarding the treatment. Because of that educator, the learning implementation will be going to be to the psychiatric illness patients. The student will be learn more. By the learning, it will be implemented. We will get the more knowledge, but the when we are doing the by clinical by practical knowledge, we have to have a more knowledge regarding our grip on the any treatment or any doses, because if the mental illness patients will be came to the psychiatric ward, when we will do, we have to be give the one drug to them. We have to have diluted the NS, and then we have to take the drug. How much ml we have to have give to the patient, and how much drug we have to be dilute in the NS with the drug, we have to have some knowledge regarding that. Then only, without knowing anything, we cannot able to give the psychiatric patient, because of that because of the because of the unknowledgeability of the taking the any action regarding the doses of anything, it will be impacting of the patent mental illness more and more. It will, because sometimes it will be impact harmful to themselves only, because of the doses are more, the low immunity having the patient. That is the educator as must be teach and everything to the student. Educator. um, Educator. Mental health care nurse has a responsibility to educate the mental illness patients and caregivers on importance of making an advance directive and nominated representative to protect the rights of the PMI. PMI means point of maximal impulses. PMI, point of maximal impulses. We can say mental health care nurse has a responsibility to educate mental illness patient and as well as the caregivers also. The mental health care nurses has a responsibility to teach the mental illness patients and the family members also. Even if the family members cannot able to know regarding the something anything, we have to have a responsibility to give the guidelines regarding the what all the treatment we are going to be giving to the patient. That and all we have to have give to the patient. As a mental health care nurse, we have to have the responsibility. What all the education we have to give the mental health care to the patient or illnesses of family members. The mental health ill patients, before we are giving the anything treatment to the patient, even if the mental illness man or woman, she is refused to take anything when we are going to be give, we need to explain the each and everything to the patient. That will be helpful to save for us, because if something will be happen during the treatment, we have to take the consent. After we have to be giving the information to the patient or the family members, we have to take the consent, which will helpful to save the, which will consent we have to take the keep safely. If something will be happen to the patient, sometimes the family members or the relatives will be against us. That time, during that time, we consent will be helpful to this consent will be helpful to show to them each and everything, and protect the rights of the mental illness patients, as well as the normal person. The psychiatric illness patients also have to have a rights to them. Without a consent, we cannot able to do the anything to the patient. Even though the patient family members are accepting our treatment regarding the anything, we cannot able to give the patient without his consent. We have to protect the mental health care right patient. Because of the right of the mental health care patient, we have to be respect them rights. That is the educator, we as a educator we have to have the qualities during regarding this. and educate the other professionals in complying with the regulations under the Mental Health Care Act for admission, discharge, treatment, and prohibited procedures. Educate the other professionals. Indicate the other professionals. As a psychiatric profession, we have under the psychiatric doctor, we under so there are so many nurses were there. So the as a psychiatric profession, we have to have educate and we have to have teach the professions regarding the anything during the shift time. If the psychiatric nurses are completed her shift and he went and other nurses will came to the shift, we have to teach the each and everything regarding the patient to the nurse, because of the reporting of mental illness patients, which will be helpful to know regarding the patient present illness. Because of basic of the present illness, if emergency situation will be happen, the nurses need to be take the any action randomly on the patient care. That is the educate the other professionals. And admission, discharge, and treatment. Admission discharge means with regarding the admission discharge, how we will take the I will admit the psychiatric patients in the hospital, and discharge procedures, which and everything we have to be have teach to the patient, which will need to be helpful to do the discharge procedures and admission procedures to the patient. Any harmful procedures are we need to be prohibited to the patient. And protector. As a protector, mental health care nurses should be aware of the rights of the persons with the mental illnesses, ensure a safe and clean environment in the mental health establishment, keep environment in sanitary condition, provide adequate and wholesome food and facilities for the leisure, recreation, education, and religious practices. Mental health care nurse as a protector. The mental health care as a educator, organizer, and the protector. We have to, as I said, we have to have protect the rights of the mental illness patients. If we are disrespect the mental illness patient of the rights, which will be they are have the mental illness patients are having the right to file the case on the nurses also. That is the that right will be that right will be enacted in the 2017 under the Mental Health Care Act. The patient as environmental also should be clean and neat environmental, and sharp needles, sharp things we should not be around the patient environmental, because of that surrounding of sharp needles or anything sharp things, sharp objectives, the patient have chances to harm themselves, and the harm the patient families, and be who are going to be going to them, it will be harm themselves. So we need to have the remove the all unnecessary objectives and sharp objectives from the psychiatric mental illness patients, because they don't know about anything, because of the mental disturbances, psychological disturbances. The man what they are thinking, if we are going to be give the any medication to them, they think that the person will harm ourselves. So they have to take the anything objectives around them, and they have to harm the other selves also. So keep the environment in sanitary conditions. Always keep the environment in the sanitary and a calm environment. We should not be create the any confusion environmental around the patient. Because of the environmental cleaning of the environment, the environment also sometimes will be helpful to the patient to get the normalize the persons also. The treatment also behalf of the chance to get the normalize the persons of the mental illness patients, and the other half of the treatment is to behaving towards the patient, how our behavior is the towards the patient, behave towards the patient before they are before them. If they are giving the any treatment regarding the anything, if the information regarding the anything, we should not be set the any time to them. Because of the time setting, the patient cannot able to give the treatment to them. So we have to have sometimes educate the religious and family members also how we have to be treat the patients regarding the anything, and how the treatment will be giving the home care treatment also one of the major role we have to have given to the psychiatric patients. Mental health care nurses are ensure the privacy, proper clothing, protect from the physical, verbal, emotional, and sexual abuse. Should not force the PMA. PMA means point of maximum impulses, and to shave has had without any patient consent. We should not be shave the patient head because it will be disrespect the patient's right in them. Right, it will be right is enacted in the, as I said, Mental Health Care Act 2017. Ensure the privacy, proper clothing, and protect from the physical, verbal, and emotional and sexual abuse. We should be get the privacy. We should be provide the privacy to the patient, and sometimes proper clothing, and the mental illness patients also, as well as they have to have a right to clothe as a normal person. We should not be give the any physical and emotional abuses to the patient. We should not be forced them to take the treatment also. The mental health care nurse must ensure that a point of maximal impulses shall have the right to receive the free legal services and protection from the all forms of abuse. Every mental person has a right to access the quality care, and as well as the access of the quality care and quantity care also. Without any quality care, if the patient is not getting the any quality care in a hospital, if they are disrespecting their rights of the mental illness patients, they have to have a right to complaint on the nurses also. So when we are going to be give the any treatment to the patient, not only treatment, when we are communicate to them, we should not be judge the patient. Non-judgmental attitude is the very important as an healthcare professions. A non-judgmental attitude is not only mental health care nurses professions, even if it is the humans, when they are talking with the others, with the we should be have a non-judgmental attitude. Because of that non-judgmental attitude, the patient will be get the free from the um, free from the what they are thinking. Actually they we have to harm themselves, they have to be believe on the on ourselves. So it will be easy to learn the information from them. So as a healthcare profession, this all the acts we have to have the we have to have in as a nurse profession. The roles and responsibilities of the nurses in implementing the Mental Health Care Act, as I said, organizer and educator and protector. Be aware of. Be aware of patients means when we are going to be before the patient, we have to be aware of ourselves. Be aware of ourselves, and as well as we have to be aware of themselves also. So thank you everyone. So do the comment on my video how it is useful for your lesson planning. It's not only helpful to the normal persons who are going to be being the 6th semester batch. It will also helpful to the who are not able to learn the each you are not able to understanding this topic. We should be refine this and comment on my video.